Good afternoon. The original audio for the first couple of minutes of this presentation was accidentally not recorded. So I'm going to show through the slides and then the presentation will pick up when we begin to talk about social determinants of health. This is a presentation on Black health and wellness, community and public wellness in cooperation between the City of Virginia Beach Department of Cultural Affairs, Virginia Beach History Museums, Norfolk State University, Joseph Jenkins Roberts Center. The session was recorded, and this is the second edition of a quarterly series that is put on by these organizations and the Princess Anne County Trading School and Kempsville High School Alumni and Friends Association. Please visit Virginia Beach museumsvb.org to take a look at Virginia Beach Museums and the new Union Kempsville Museum, which has just reopened for visitors. Basic webinar etiquette, and now we will jump into Dr. Cassandra Newby Alexander talking about social determinants of health.
Racism, that racism puts a huge is a huge factor in how people are looking at, well, I should say racism is an important factor in how it impacts health and well-being, but also, of course, civic participation. Whether your community really actively participates in advocacy, in advocating for the health and well-being of their communities. Are there parks and recreational areas within walking distance, et cetera, et cetera. Let's move to the next slide. So here are a few quick facts. We found that 18% of African-American adults are in fair to poor health, that 19% of males are smoking, while we have 12% of females are smoking, 38, almost 39% of excuse me, of males, and almost 56% of female adults have issues. Sorry, 14.5% do not have any health insurance. And we see that two of the leading causes of death among African Americans is heart disease and cancer. And the last time we had a webinar, we actually included COVID-19. And since more and more people have been getting vaccinated, and there are some remedies to that, we have seen that particular issue decrease significantly. Next slide, please. So, African-American health inequities. And this is from the statistics from the Families USA. And I thought this was really interesting. So when we look at infant mortality, that African-American infants are 2.5 times more likely to die as infants. The sudden death syndrome, African-American infants are twice as likely to die from that as whites. With asthma, children, African-American children are twice as likely to have asthma. African-Americans are 56% more likely to be obese, and depression is very high at 61%. So those are some sobering figures that we found. Next slide, please. And these are some, I thought, really important issues. Looking at diabetes, that 72% of African Americans are more likely to be diabetic, 44% are more likely to die from a stroke, 40% for breast cancer, cervical cancer, and there are some issues that we'll deal with in terms of the verbiage here, but 52% are more likely to die from cervical cancer. Obesity, 23% are more likely to be obese, 25% are more likely to die from heart disease. So when you look at all of these particular statistics, what you're seeing are issues having to do with access to healthcare. So some of these are the result of social determinants, not so much that African Americans are more predisposed to these particular illnesses, but rather African Americans really have a lot of social determinants that result in these higher rates. Next slide, please. So to join me in this incredible discussion that I hope we are about to have, and I hope because I'm of course expecting a wonderful discussion from our guests, I'd like to introduce our panelists. And the first one is Mickey Fuller, who is a nurse. She graduated, hang on just a second. She graduated with a Bachelor of Science in Nursing from Hampton University. She has a master's degree in public health as well, and from Old Dominion University with a concentration in health promotion and education. She is a registered nurse, a national board certified health and wellness coach, and she's currently employed as a population care nurse with Centera's Optima Health Plan, where she implements evidence-based preventative health strategies to improve the health, wellness, and quality of life of her members. Welcome, Mickey Fuller, to our panel.
Greetings, thank you.
Our next panelist is Deidre Love, next slide please, who is the founder and chief executive officer for Teens with a Purpose. She is really a visionary and has been a staunch advocate for many, many years. She was born in Harlem and relocated to Norfolk in the late 1980s, where she is with her husband, raising their 3 sons. Her organization teaches people that they can be their own experts. So to take agency, in other words. And her leadership really has allowed her to be a trailblazer with this particular organization that helps to promote youth literacy, arts, and the development of a youth poet laureate program. And of course, Teens with a Purpose was founded in 2008, and they have this Virginia Youth Poet Laureate program that will begin in 2023. So they're expanding statewide. She is also part of working hands-on working in the community, creating an oasis within the blighted community. And she has been awarded, I should say recognized and awarded by a number of organizations, and we just put a few of them here. She's been named as Outstanding African American by the Virginian Pilot in 2010. As well as a recipient of the Community Service for Wavy TV, and an All-Star Award recipient in 2016 by the Cultural Alliance of Greater Hampton Roads. Welcome, Deidre Love. And last but certainly not least is Dr. Olivia Newby. And I am especially excited and proud. Olivia is my sister-in-law, and I have seen such tremendous, not only opportunities for the community, but also tremendous activity by Olivia. She is a family nurse practitioner at the Primary Care Specialist in Norfolk, right next to Norfolk State. She's a certified diabetes care educator and the co-founder and president of the Healthy Living Center Foundation, which is a nonprofit organization that focuses on outreach, disease prevention, and health promotion. She has also co-authored the National Standards for Diabetes Self-Management Education and Support. She holds a BA in nursing from Howard University, a master's degree in nursing from Hampton, and a doctorate of nursing practice from Old Dominion University. She's also certified nationally with diabetes education and support, and she is a certified diabetes lifestyle coach. And she works, of course, in primary care, entrepreneurship, culinary medicine, research, and diabetes education. And currently, she is the president of the Virginia Council of Nurse Practitioners. So, Olivia Newby is all over the place, and she is a constant invited speaker at national conferences throughout the country. She is also a recipient of a number of awards, the 2021 Fellow Duke Johnson & Johnson Nursing Leadership Award, and a 2020 inductee of the Fellows American Association of Nurse Practitioners. Welcome, Dr. Olivia Newby. So let us get started. You can just go right on through that particular slide. And so I would like to actually begin with our first poll to the audience. And so we will put the poll up for about a minute, ask you to just select which one do you think is the most critical health issue to address for your community, and select your answer, and then we're going to pose a question to the panelists, and after that particular discussion, then we're going to find out what the results of the poll is. Okay, all right, so let us go to our first question to our panelists, and I think we can close out our poll. So Stephanie, if you would close out the poll. If you haven't selected, go ahead and select. All right. So my first question to our panelists, and I'm actually going to ask Nikki Fuller to answer first, and then go to Olivia, and then go to Deidre. What are some of the most challenging issues facing African Americans and their health today?
Again, good afternoon, everyone. So I am a registered nurse, but I chose to answer this, or I'm choosing to answer this more from a coaching perspective, because that's really where my passion and my work lies within the realm of nursing. So when I'm looking at challenges that impact African Americans, I would say that if I could give three, one would be self or intrinsic motivation, the desire to actually want to make a change, right? Second, I would say self-efficacy, and that's specifically the faith in oneself to make the change. So we have desire, then we have the faith to do it. And then third, I would say readiness to change. And that's kind of assessing where we are, which is important to know before we can determine how to get where we want to go. So I would say those three, intrinsic or self motivation, self-efficacy, and then determining where we are in readiness to change.
Well, thank you. Olivia, what are some of the most challenging issues facing African Americans and their health today?
I'm going to pivot behind Mrs. Fuller's comment of self-motivation on the paradigm of diabetes, because one of the chronic ailments that I see in primary care is diabetes. And in order to make a significant change, you have to be motivated. And a lot of time depression is associated with diabetes. And we have a lot of tools out here, but if that patient or the person is not motivated to change, then it is no progress. Thus, the complications ensue.
Thank you so much. Deidre, what are some of the most challenging issues facing African Americans in their health today?
I really think a big issue that we have is that we don't talk about the issues the way that you describe them. A lot of times we talk about someone is overweight or someone has this or that as a negative thing, which causes a person to feel bad about who they are and have that critical outlook on their situation. So it's really hard to be hopeful or have a desire to make any type of changes when you don't, when the understanding of why you find yourself in this situation is not discussed. Is we don't say enough about how how racism has an impact on that, how the trauma and the stress of life and living under certain circumstances has an impact on that, or talk about other things besides changing diets or even exercising. Just basically, we don't give each other enough space for that positive self-talk that for me, I think when you see yourself as whole and human and valuable, that's the beginning of a desire to change anything. And so us being more encouragers and us being more present in what causes us to be where we are, and then being more focused on having conversations that uplift one another, that will encourage the changes that we need. So I think our self-talk built on what we've been told about ourselves is a big challenge when it comes to our health.
Thank you. Next question. What are, not what, but why are diabetes, high blood pressure, high cholesterol, prostate cancer, and heart disease some of the most critical threats among African Americans? And I know that there are a few other threats, but why are these in particular such critical threats? Olivia, can you chime in on that for us?
All of these chronic ailments have significant complications. And if we do not address them, they create a lifestyle of poor quality of life. Because once you're diagnosed with diabetes, hypertension, elevated cholesterol, leading to heart disease, it puts you in a at risk for many quality of life of working and of making financial improvement. And a lot of it has to do a lot of time on our dietary habits. So part of that is, how do we make change from what causes it? Because according to the CDC, a lot of time is that lifestyle, exercising and addressing our cultural habits of these chronic disease. And a big part of it, again, is our cultural impact of our dietary habits, because every one of those listed reflects how do we see ourselves, how do we change, and what is the cause of it. And then finding a pathway culturally that appropriately address all of it in a self-motivating way. And that's it.
Yeah, thank you. Mickey.
Yes, in alignment with Dr. Newby, I would also say in one way or another, these are all silent killers, meaning the symptoms of this these specific chronic diseases may not send us to the hospital. It's when we're having the stroke, the heart attack, the chest pain, the headaches, that we then go render care. And at that point, it could be critical, it can be fatal. So culturally, as a people, if it's not broken, we're not going to fix it. If it's not falling off, we're not going to amend it, or we're not going to mend it. And it's work, but the shift really needs to happen when we become more preventative than reactionary. So these, I don't want to say one's more important than the other. They all are. And from my perspective, they're all silent killers. If we wait to find out where we stand with any of these, the turnaround that we could have made if we were more proactive is lessened, and it could cost us our lives.
Thank you. Deidre.
Not being an expert on any of this, but being an observer of things that I've seen change people's perspectives and also change their practices. I just want to go to the garden that we developed, this half-acre space. And when we started building it, and we're in the St. Paul's community surrounded by 4 public houses. When we started building it and putting in the flower-lined walking paths, community members who used that space when it was just a gravel lot to get from one point to another would avoid walking on the flower-lined path because they didn't see it as something that was there for them. And that was telling to me about how we see ourselves and what, so I really was connecting it with health, because we owned the, we got phones ringing like crazy. We created the space to share, to build health, but the people that it was there for didn't see that as something for them. And that was the beginning of my thought around all of this. And then the next thing I noticed, when people used the path, that slowly they took time walking along it, and that's building health because you're in a healthy space. And then they started slowly knowing that the vegetables and fruits were there for them, and slowly started to pick them and eat them. And I guess what I'm leading to is all of the things that are killing us that are mentioned on that screen really always, to me, starts with how we see ourselves, what's available to us. And it's a slow process of changing our minds and our attitudes and our habits. And I just feel like it's a lot for us to work on, but there's simple steps that we can take to move that along, because to me, all the diseases mentioned there are not just a physical manifestation. It was fed by emotional, and it was fed by all the other things you mentioned at the very beginning of the talk. So we'll never dismantle until we address little by little, but first how we see ourselves and treat ourselves, and that we walk that walk because you eventually want something different for yourself when you see yourself as different. Yeah.
Thank you. One of the things that is really striking to me, I have a friend who was diagnosed with prostate cancer. And one of the things that he found out was that typically when men are being screened for prostate cancer, they're looking at certain types of prostate cancer, but many African-American men don't get that particular type. They get another type for which they're not being screened. And as a result, they're in stage 4 by the time they discover they have prostate cancer. So some of these critical issues seem to have a lot to do with the medical approach to healthcare that is non-inclusive of African Americans. And I was wondering if anyone could speak to perhaps some of these issues that are part of our system as opposed to part of our lifestyle or our specific choices.
If I may, to your point, and prostate cancer is one, there are some breast cancers, same, but just at large, and I work with an insurance company, but some of it is insurance driven. What will the insurance cover? So there's a plethora of tests, there's a plethora of screenings that are available. But for many of us, we're considering what can we afford. So our insurance covers A, B, and C, but 1 through 7 are also available, but they come at a cost. And when you have to consider, do I put food on my table, or do I evaluate if I'm in a particular risk category, you're going to put food on your table. So I feel that's a macro level issue where there are things that are not covered that could be considered preventable. So to your point with the PSA, or the antigen test for prostate cancer, we started out, or medical science started out with doing the digital rectal exam. And we knew that was not a go for many of men of color. However, there are other specific tests that are available, but may not be covered by insurance. And what I also would like to lend, sometimes providers are not making consumers aware that these other tests are available. So we're going to test you for this, this, and this, but there's really no discussion on there are other tests available, but they may come at a cost. At least help our clients, our customers be the most informed consumers, and then they can decide.
So it sounds like education is really critical, and getting that education to the larger community is equally critical. Let's go to our next poll. And this one has to do with community health. And we want to answer this question as quickly as we can and move on. And then I think at the end, we're going to look at the results before Q&A and have our panelists talk about the results. So with community health, what community health issue do you think is the most critical for your community? Is it access to groceries and fresh food? Is it access to safe recreational space? Is it drugs, alcohol, tobacco use, or is it gun violence? Choose one of those 4 examples, and you can only choose one. So we're going to give you another 20 seconds to make your selection. But what community health issue do you think is the most critical for your particular community? Each community is different. And so which one is it? Access to groceries and fresh food, access to safe recreational spaces, drugs, alcohol, tobacco use, or gun violence? So Stephanie, are we ready to close the poll? Yes, we are. Let's go to our next question for our panelists. And I'm going to start out with you, Deidre, because I wanted to really know, what is your organization doing to address some of these challenges and threats?
Thank you. First thing I'd like to say is thank you for listing gun violence as a health issue. I think that gets overlooked too often, and I'm glad to hear that being put on the list of community health issues. So we do everything that we possibly know how to do. I mentioned a little bit about the community garden, and that public space, we call it a peacemaking space as well as placemaking. And one of the ways we address the challenges is by making a space beautiful, bringing fresh fruits and flowers and art and culture, celebrating our culture that address a lot of the things that, our organization holds most important: how people see themselves, how they feel, how they're treated, and how they're celebrated. And then sharing food, having young people model in the community through the arts and through the garden space, how beautiful young Black teenagers are, and that we are not what we are told we are, and and modeling for other teens who may not understand themselves the way that we do, that I'm a reflection of you, is another way that we are addressing these challenges. So we have fresh food that young people plant and grow, give away to the community, learn how to cook and eat for themselves, because they don't mind growing it, but they don't know if they want to eat vegetables, but we try to encourage that inside of the work that we do. And for us, a lot of the work, even in the poetry, is vocalizing and sharing messages about public health, like gun violence, which is a big public health issue for our community. Young people are talking about it, so they're processing it, then they're writing about the issue and ways out, or how they feel about it, so they're sharing it. So there's a dialogue that is a critical part of change, just being able to express it. So we use the arts to do a lot of our work, but that public space, that placemaking, that peacemaking space, we witness people's lives change on the whole spectrum of health issues. Families that come through and say, we didn't have food, and joke and say, I was a vegetarian for 3 months, that garden fed me. That empowers a young person because they know they're having an impact. But we know that, food is being eaten, seeing somebody sitting by a goldfish pond in a community where we're not supposed to have anything but a brick building and the bare minimums, but there's a space that is in other, affluent communities, that people that live there actually built it. So it helps you shift your mind. It helps you build that confidence and that self-esteem, that self-efficacy, health, and wholeness.
Well, it sounds as if what you're saying, Deidre, is that your organization is really trying to help build self-confidence, a sense of self-ownership of your world, and joy. And you're saying that you really see that that's having a direct impact in the health and well-being of the people who are involved. Is that correct?
Yeah, we witness it daily, the changes. We witness families grocery shopping, with their little shopping bag, getting what they need in that space, and people growing flowers, and people not walking through a space, but spending time there. Young people being, have that sense of pride that I'm doing something that's having an impact on my greater community. So all the types of things that we're told by society you're not, that builds that trauma and that lack of esteem. So regardless of where you are in life, like your economic situation, knowing that that is not who you are, and really helping our community see ourselves for who we are right now and what we have right now, not what we are missing. So that really helps people walk in the direction of health. And then we see them when they take the step and they're moving along that spectrum.
That is really interesting. And Olivia, you're doing a similar type of thing from your Healthy Living Center. Can you share a little bit about that?
Yes, so this Healthy Living Center, which is the nonprofit, we are currently doing since January, we do a 4-week plant-based cooking classes with education. And we take the participants review, and it's based on their chronic ailments for 4 weeks. And we talk about the disease, how it impacts you, and some information about it for 30 minutes. And then they proceed to learn how to cook that meal and to season it without using the typical things that make food taste good: sugar, salt, and fat. So the plant-based approach teaches them how to put it together, and all the ingredients are affordable, somewhere you typically would find it at your local grocery store. And it gives them the opportunity to say, you know, I wouldn't have fixed that. Last night we did a stir fry, we added zucchini and squash, and none of them would have added it without adding our typical meat seasoning. And all of them said, I wouldn't have never cooked it like that. And so we take approach of meet you in your kitchen, you put it together, and it has been so successful. This has been a great opportunity for them to not only impact improvement of their clinical health, but they take it home. Just today, one of my patients talked about how it improved, how she makes the boundaries of what, acknowledging the risks related to all of those diseases, but yet she's impacting her children who, and as all of us know, if your mother and father have it, your risk of having diabetes relates to you as well. So she's teaching her family, her children, and her grandparents. So it is literally an opportunity that they can get involved in, and also I do a community garden. And we go and I pull the food from there and show them how to prepare fresh foods as well. So that is what the Healthy Living Center is doing for this year. And
So you
done
have
multiple.
you
Go
have
ahead.
some samples right there with you of something you just pulled from the garden.
Give me
And
1 second to grab them again.
while you're waiting to grab them again, because I think people really, you know, we're at lunchtime, so people need to see this to
My
stimulate.
zucchini. This is yesterday I pulled, and my squash. So this is new. And if you go on the Healthy Living Center website, you can see about the cooking classes. It's open to anyone who meets the criteria, and it is through a grant with Centera, and it is an opportunity. You can see the garden and what we're doing in the community.
So what are some of the criteria?
Diabetes, pre-diabetes, hypertension, heart disease, hyperlipidemia, high cholesterol, being overweight, and are obese.
So
Pretty
please
much.
explain
ahead.
the difference between diabetes and pre-diabetes.
Pre-diabetes is, well, let's start with diagnosis of diabetes. We base that off of 2 criteria, a couple fasting glucose and A1C. And this tells us what your blood sugars are running at a certain, as a fasting or through a 3 months. So once you establish that number of pre-diabetes is 5 points. I won't get into all that. So it's before you have the diagnosis, and we sending you a warning sign. If you don't change, we also are the only CDC diabetes prevention program that is fully certified in Norfolk, and we are in the community. So pre-diabetes, we don't give you that official diagnosis until you meet that criteria of the clinical. But we want to say it's like riding a tricycle or bicycle. We take those training wheels off, then you're good. But while those training wheels on, you're in the pre. But don't play around and don't get into those clinical measures that throws you there. So you don't have the diagnosis, but you can change it. You don't have to become diagnosed if you meet the criteria of typically it's losing 3 to 5% of your weight and other measures. Simple.
And I have one other follow-up question. It has to do with the cooking. So what kinds of things do you use to cook with? Not the main ingredients, but if you use any oils, what kinds of spices?
We typically do not use, if we use oil, it's an olive oil. And if we use a spice, it's no salt, or we use pepper, we use rosemary. And we teach them how to shop for spices reading labels. All of the classes read labels. And your spices are anything without a seasoning, without salt. And so we use garlic powder, things of that nature, basils, rosemary, all of those. And we show them how to use it and so forth. Yes.
And hopefully my favorite, cilantro. This seems to go
Yeah,
with
basil
everything.
and cilantro we grow, and we will be, each week they get tested on, or exposed to those herbs and how to use them. We did not, culturally, I did not grow up with those things. So the impact is bringing their taste culturally and affordable, with the ultimate goal to reduce their clinical manifestations.
Sounds really good, making me hungry. Mickey, what would you like to add? What is your organization doing?
So as Dr. Newby mentioned, the Diabetes Prevention Program, Centera, has linked up with our local public health providers to be able to provide that program to people, specifically for the insurance plan, both Optima and Virginia insurance plans, Optima and Virginia Premier. I work on the preventative healthcare side, so I do a lot of education and support members around having preventative health screens done. And in addition to just, educating them, I also have the advantage of being a coach, because I can kind of get into the weeds with them or take a deeper dive to why there's some resistance to having particular tests done. And, they're the experts of their health, if you will. I have a lot of know-how as, their advocate, but it's really coming to the table and really having discussions around the preventative health screenings and alternates, if applicable. That's my current role. In addition to that, both my current role and historically, especially when I work in case management, we have done a good job of identifying people at risk for, and I don't like to use the word non-compliancy, but who may not want to comply with the recommendation. I'll say that. So specific to Optima and Virginia Premier, we have what's called the Focus Care Program. And this is a program of identified individuals, identified members who are at risk, either because of mobility issues or because of other social determinants of health, that we bring the services to them. So it's house calls, if you will, by nurse practitioners and registered nurses and some other support staff in order to help them engage in their care when there are blockages and barriers and delays to the traditional way coming into the office. As a case manager, I'm listening to what Deirdre and Dr. Newby are saying, and I'm thinking, what haven't I done to help support people? I've gone to the grocery store with patients. I've gone to the dollar store because, a lot of people, affordability is a priority. So, okay, let's go to the dollar store. We can still make this happen. And we're going to hit the kitchen aisle and let's get a colander. Why are we getting a colander? Because if all you can afford, outside of gardens, of course, if all you can afford is canned fruits and vegetables, but you have diabetes, or you've been diagnosed with diabetes, you've been diagnosed with cardiovascular disease, we can take those canned items and make them, in essence, healthier. Let's get the colander. Let's add the peaches that are laden in the heavy syrup. Let's rinse that off. Now we've eliminated some of the sugar, and you're getting still allowed, able to have fruit. Same thing with the vegetables. So there's not too many things I haven't done. I have gone to people's homes, which was very much part of my role, and do in-home education, because it seems to hit different when I'm in your home than when you're in the doctor's office. And I prefer to be in your home because you've invited me into your environment. I want you to know you have control in this, and I'm here to partner, not to take over. So we'll go through your cabinets, and we'll go through your refrigerator, and we'll go through your freezer. We'll even kind of find ways to not maybe throw away everything you have, but how can we offset? Instead of having 3 tablespoons of mayonnaise, how about we use an avocado slice and maybe 1 tablespoon of mayonnaise? I am all for it. So whatever that's within my power to do, I have and will continue to do it.
I have a couple of follow-up questions for you, Mickey, as well. And that is, I've encountered people who kind of that maybe they should be eating a little bit more avocado or, more fruits and vegetables, but they're not used to it. Olivia mentioned that earlier. And so how do you help people to traverse this difficult pathway from going from what they're accustomed to a whole new way of eating that they will probably very much enjoy, but it's that barrier of fear that I'm not used to it, so I don't want to perhaps try it just yet. How do you help people through that?
So
Well,
it's a dance. Oh, myself or Dr. Newby?
Oh, go ahead, Fuller. I'll come behind you.
It's a dance because we get that a lot. I don't like it. Oh, okay. I'm the queen of why. Well, why is that? So then we really get into the nuts and bolts of it. Is it texture? Is it past experience? Is it what you heard about it? Is it what you fear it's going to cause? That we kind of take it there. And then from there, I kind of meet you where you are and then determine how can we move forward. So I'm good for the sneak-ins. For example, I just found a recipe or found out about a recipe, I think it was Monday, in making brownies, which most of us love, but instead of adding the oil and the eggs, you can put black beans. Who knew? So it's finding creative ways of, it may not be an all cold turkey, I'm going to be a vegetarian or vegan tomorrow, no. But we do want to support you in increasing your whole foods. So finding ways of integrating them into what you already have. It doesn't have to be a all or nothing approach. It could be, let's kind of like titrate this. So for example, culture is another thing. We have to consider culture, right? So me telling someone of the African-American persuasion to never eat rice again, it's going to be a no. But how about we take a cup of, well, how much do you generally eat? Okay, 4 cups. Okay, how much are you willing to decrease to? 3 cups? I'll take it. Okay, in that 3 cups, would you be open to maybe doing 2 cups of the regular rice, and then that 3rd cup, instead of regular rice, what about some cauliflower rice? Let's mix it in and season it well, with low salt and high flavor herbs and spices. Let's try that out, So I come with everything in my arsenal to help people. So yeah, being creative, maybe introducing it intermittently versus a all or nothing. But I really feel where we need to start is why the aversion exists in the first place. For some people, it's a texture thing. So we might need to prepare it in a way that is appeasing to your texture. I'm going to have gas. Gas don't last always. There are ways we can work through that too. So I'm here for it. Whatever they bring me, I have something, a comeback.
Sounds good. Olivia.
Nikki, I'm in your corner. You are just really speaking the truth. And with that said, I'm just going to end with culturally, one of the cooking, they have a breakfast and we do avocados. And that is a no-no. When they sign up for the program, they have 4 commitments. And one of them is you willing to try what I give you. So since I'm paying for lunch, go for it. So we try it. And then 100% of them, I deal with the texture issue. We all as African-Americans use onions and celery. So I pop those things in there. And we like a little pop to it. We like a little this. So I address it. They all enjoy it. Last night, they didn't like mushrooms. We learned how to hide it. Works. You must come. They set the stage and I said, they let me open that door and they have to try it. And since I'm taking them to lunch, they all do it and everyone enjoy it. So please be aware. And so we work with them instead of them needing to feel the work with us. And always 99.9% prevail with their, so this has been a great opportunity, but yes, we work with them and to meet them where they are.
That sounds wonderful. So I am ready for the 3rd and final poll before we get into our last 2 questions. So this one has really to do with change. So everyone who's attending, what is one thing you're going to do to improve your own health this summer? What is the one thing you're going to do to improve your own health this summer? You can only choose one. Are you going to stop smoking if you're a smoker? Are you going to exercise more? Are you going to make dietary changes? Or are you going to do something that will lower your stress level? I know sometimes you want to choose more than one, but choose one. So once again, we'll taking this down in just a few seconds. What is the one thing you're going to do to improve your own health this summer? This summer, stop smoking, exercise more, make dietary changes, or lower your stress level. Stephanie, are we good now and we can take the poll down? All right, next question. We have 2 more to go. And this one, panelists, you know, you have said some incredible things. I'm excited about all the things that you all are doing. So how can people get involved with or take advantage of what your organization is offering, the services that you all are providing? And so Mickey, can you tell people how they can get involved with what you're doing, especially as a lifestyle coach?
Absolutely. So from the preventative health screen side, your medical provider, nurse practitioner, PA, physician, DO, they're going to address those things. It's kind of like we've agreed to do this on behalf of our members. So our providers, you know, recommend what testing is needed and when, and obviously the recommendation is to have at least an annual physical. You know, so I kind of am on the back end of that. It's when you didn't get it done is where I get involved in terms of my professional work as a top care nurse. But as a coach, I can't advocate for coaching enough. When I was a case manager, we had a presentation by Johnson & Johnson, and it was on motivational interviewing. And I thought, this right here, this is what's been missing the whole time, you know? This is a way to have people be more engaged in their care, because again, they are the experts of them. We are the experts of a lot as medical professionals, but they are the experts of them. So I'm seeing more motivational interviewing being used, but obviously not to the degree that I think would be most prudent. Be that as it may, health coaches are starting to really show face in public health settings. Matter of fact, the National Board of Certified Health and Wellness Coaches is actually working on awarding nationally certified coaches NPI numbers to be able to bill for their services. That's a game changer. Could you imagine if Dr. Newby and I work together? She comes up with the goals that need to be addressed, and I'm helping them to do it, or someone like myself. Oh my goodness. But anyway, no toot of horn. I'm just saying, ideally, that's how this would work. Providers don't have the time to do that deep dive, but I've been trained to do it, right? So if you are independently looking for a coach, there are ways to find them. We're out here. Those who are nationally certified, we are on a directory. If you go to the National Board of Health and Wellness Coaches website, and if you go to directory, it lists, you can filter by many, criteria, state or whatever. Many of us have our picture, not me though, but y'all remember my name. So if you see you won't see my face, but you know my name. But you can filter, and specifically one resounding thing that many people tell me is they want to work with providers who look like them. I respect it. I understand it. So at least going through the directory, because pictures are posted, you can see what your potential coach would look like. And then you would link up with them, through the contact site. But health and wellness coaching has statistically, because it's evidence-based, it has by leaps and bounds helped providers to improve the health of our members. So I would say providers, look into having health and wellness coaches to support you in the work that you're doing, because we can work more on the consistency end. A lot of patients are seen and then they're not seen again for 3 months or 6 months or a year. And there was no movement from, yes, doctor, I will do this, to, oh, see, what happened was life happened since the last time I saw you. We're there to kind of help them navigate through life and still be healthy. So health and wellness coaching can be billed currently as a CPT code, that's specific language to Dr. Newby, but moving forward, it is a very strong possibility that we will be able to bill. And that will be a game changer because there will not be too many places where we won't be able to serve.
You know, I would like for each of you, if you have some contact information that you would like to share, a website or whatever that you would like to share, please put it in the chat for our guests to access. Olivia, how can people get involved with the services that your organization is providing?
We are always looking for volunteers to help with the cooking classes. You can see them on the website, Work with the Garden, and like today, in the next hour or two, we do group visits for people with diabetes, and I cook for them to show them how to prepare that meal. And we always looking for volunteers to help in that sense. Yes.
Wonderful. And Deidre, how can people, I see you've already put some things there in the chat. How can people get involved or take advantage of what your organization is doing? And most importantly, how can they help by donating?
Absolutely. That, as a nonprofit organization, donations are really how we're able to provide all the programs that we offer, and they're all offered at no cost to any of the young people or the families that we work beside. Things that people can do to get involved, especially along the health spectrum, would be our community garden. We are out in the garden 9 a.m. to 1 p.m. every Saturday, and that includes community yoga. We have a free community yoga class every Wednesday inside the Teen Center at 700 East Only Road, and that is an accessible yoga, so it includes chair and mat yoga, and even visualization for those who are not able to move around freely at the time. Other things, we have the garden program, but we also have something called Hip Turns, and that is a paid internship program for teenagers to learn how to care for and maintain and develop the community garden, to be a role model to the community and to their peers. And we accept applications for that all the time. We raise money, and that's where donations come in. We raise money from donations to pay them. It's a paid internship. Young people need money, and that's one of the ways gangs and other things attract them to things we don't want people doing. So we try to incentivize young people to stay on the right track by motivating them with money as well. Volunteering. We desperately need volunteers to keep all the things that we offer going. We do a lot of other community events, like we just finished something called Fuse Festival, which started with maybe 200 people, and this year we had 2,000 people and all kinds of resources. It was amazing collaborative space where different organizations and individuals came and shared their resources, shared their talents, and made it a transformative experience. So things that you can walk away with that carry you beyond that day, and also sharing culture inside of that space. So like Mickey mentioned, people want to see people that look like them doing the things that we're always asked to do. And so modeling as a volunteer is, a really important thing for us. Yes, donating, volunteering, internship programs. We seek, most of our staff come from our internship programs with TCC and NSU and ODU, and young people who grow up in the organization. So sending interns our way, because that way they get to build relationships with young people and as they grow into their careers. So we're big on relationships and being present continuously in communities. So those are things that that we would love to be able to do together.
That's wonderful. So we're going to go to the last question before we have our Q&A. And this is going to be what I call the lightning round. So I want each of you to just tell me, what are your top 3 simple but actionable steps that the audience can do right now to improve their personal and community health? And I'm going to ask Olivia to go first. You're muted.
Okay, healthy eating, increased exercise, and mental health rest.
All right, Deidre. Deidre, yeah.
Yes, I'm here. Just 3.
Just 3. Your top
Okay.
3.
Top 3, I would say celebrate self, just as you are right now. I would say play more, because you're exercising, you're releasing toxins and all those things that make us ill. And experiment with food. Try something new and healthy on a regular basis. Have fun with it.
All right. And last but not least, Mickey.
Live, laugh, and love. Live in the moment. Don't judge your past. Don't be too far in the future. Right here, right now. Laughter is medicine. And before you can love anyone else or expect love from anyone else, you have to love yourself first.
Thank you. And now we're going to go to what the results of the poll are. So Stephanie, what are the results of our first poll? So we have a tie between heart disease and diabetes. And it sounds like these are the things that Olivia and Mickey said were actually 2 of the top issues in African-American health and well-being, and then followed by cancer. Let's look at that next poll. Poll number 2.
There we go. Sorry, I have to show each question separately.
That's all right. Community health. What community health issue do you think is the most critical? The top one is access. Access to groceries and fresh food, which really falls very much in line with the statistics that we have seen on the limited access, especially in predominantly African-American communities, followed by drugs, alcohol, and tobacco use, which may have a mental health component associated with that, and gun violence, tied with gun violence. So we're seeing the reality. This is a perception people have, the reality of what are some issues. Let's look at that last poll, change. Oh, exercise more. So we have an audience that's in my camp. The goal is to exercise more. And then we're tied with making dietary changes and lowering that stress level. I think we're all kind of in that post-pandemic realm, and that is a big, big challenge. And right now I'd like to invite Dr. Ray Bain, who is a former school superintendent, and he is currently the board president of the Princess Anne County Training School Union Kempsville High School Alumni and Friends Association. So welcome as we get into our final part of our discussion. And Stephanie, if you could just go to the next slide. I'm sorry, not Bain, I apologize, Spain, Dr. Ray Spain. I wanted to just put that up here as we are then taking some of the questions, because I think for those of you who are interested in reading a little bit more, these are some great resources. And so Dr. Ray Spain, let us have you give us your thoughts about some of what we've discussed today about the challenges in Black health and wellness and some of the choices that people want to make to improve their health starting this summer.
Okay, good afternoon. Can you hear me?
Yes, we can hear you.
Some technical problems earlier, so it's good to know I've kind of solved those. First, let me give a few words of thanks to Norfolk State University, Virginia Beach Cultural Affairs Department, as well as those Margie and Edna and our organization for collaborating on this. It's such an important topic, and it's one that really plagues our community. It's our health and wellness, and it's so good to hear this thoughtful conversation. I think the panelists are tremendous. Ms. Fuller, Dr. Newby, as well as Ms. Love, and it's good to have medical professionals, but also someone that's really focused on the community to try to make some of this, I guess, make it work in on the street or in our community. So kudos to the panelists, very thoughtful conversation, and I so much appreciate that. Also, I was surprised and really excited to hear discussions around plant-based diets and healthy eating. I've been a vegan for gracious, probably over 12, 15 years now, and it certainly has made a difference with me. And I credit my state of health, which I think is fairly good for someone of my age and with our family background in history, with all the things that you talk about: heart disease, diabetes, and so on, high blood pressure. So it was good to hear that conversation, and I think that would make a tremendous difference, and meeting people where they are, I think is so important. So I'm very excited. It's good to hear these conversations. They're very not only thoughtful, but based in a lot of research and a lot of practical advice that folks can follow. So I want to thank everyone for, particularly the panelists who did an excellent job for this this webinar, and I also thank the organizations that collaborated. And Dr. Newby Alexander, you are such a fine facilitator to guide us through this discussion. So thank you for what you do and your interest in helping those in our community to be focused on their health, and I just think it's something that hopefully we can share on a broader basis, maybe with YouTube, and providing some opportunities for folks to listen to this who didn't get a chance today. So thank you all, and I'll not take up any more time. I can probably talk for a long time, but I'm sure you want to get to some of our questions from our guests. Thank you.
Well, you're so very kind, and thank you so much for your comments. And yes, we have some questions, and you are, Dr. Spain, invited to participate in our Q&A. So Stephanie, what is one of the first questions that we have from our audience?
The first question we have from our audience was asking if someone could speak about the importance of recognizing spirituality as part of African American health.
Well, it sounds like Mickey Fuller is ready to go with that one.
Because it's such an important component. And like I said, I have the luxury of having these conversations with members. I can remember when I was, oh, I don't remember what department I was working in, but we had to do what's called a health risk assessment. And I remember I almost did a cartwheel. I didn't do a full cartwheel, but it was a half one, because for the first time in a long time, and I've been a nurse 25 years, I saw alternative health and spirituality being addressed in an assessment. These are things we need to know up front because we want to uphold your spiritual and religious beliefs and things that we need to be sensitive to and around. And also your spirituality impacts your health. Your religion impacts your health as much as what you eat, how much you sleep, how much exercise you get. It's important. It is a key factor. So it is very important to consider that in looking at a person holistically and not just their diagnosis. This is very much a part of who they are.
Thank you. Anyone else want to take on that question? If not, we'll go to the next question. Stephanie.
All right, our second question was to discuss, someone was asking if someone could discuss a little bit more the impact of the environment on African American health. And I know Dr. Newby Alexander has alluded to some of this in Hampton Roads, particularly with the trains and the coal dust in Black communities. So I was hoping somebody could speak on that.
Well, I will start off. One of the biggest things is for a lot of the chronic ailments that we have mentioned is the ability to go out and walk, just daily walks. In our neighborhoods, we have a lot of cement. Urban areas, there's no walking path, no trees. One of the books I implore everyone to at least look at, the Color of Laws, which is how the housing system was set up according to where you live. The cement, which increased population, may have more asthma. If you can't go in neighborhood and make a nice bicycle path, when I go certain areas where there are bicycle paths, there are also places for people to just sit in among parks without fear of being or some adverse reaction. So the environment plays a major part of where and how a lot of my seniors, I said, go walking in the morning, but that's not feasible. Go just ride your bike with the kids. It's not feasible because we don't have those easy walking trails. So that's a big part of it.
Anyone else want to speak to this?
Yeah, I'd like to add to that. As I shared, a lot of what I know is what I've witnessed firsthand. And I know with developing that half-acre little oasis, things that we visibly observed, like you mentioned, how in communities like this is gravel, it's cement, and few trees. Well, as we started to put in the trees, we noticed even the noise level of the cars going by, and you can smell a difference in the air. We started to notice people taking their time to walk through the space and not using it as a way to get from point A to point B, which meant taking in something positive and feeling good in the moment that you're walking. We noticed that birds that we never saw in this area were gravitating here. We put in a rain garden, and we noticed the flooding levels decreasing. We like witnessing real time and having real conversations with young people as they build these things. That makes you very much aware of what other communities have and what we don't have. Also makes you very much aware of what we can build for ourselves. But the quality of those things have a tremendous impact on starting with your mental health. Like you can notice a difference. When we started, people walked past and watched you. Now, if you come in this space, there's so much conversation around the fish pond. There's so much like real community happening. It wasn't that people didn't want to do that. The space didn't exist for that wholesomeness that builds health. So just, knowing that those things are so critical, and also something I like to always encourage is finding ways to build it for ourselves. Because we started doing that with just a raised parking island bed, the little islands in the middle of the parking lot. We built a raised bed there, and that was the beginning of what is now, Purpose Park. So knowing that we can do these things for ourselves, but they really are critical, and they're available in other communities, and we have to make ways to make them available for us, because it's going to shift our health. Almost overnight, you start to breathe better. Even if the air quality isn't better, just slowing down and taking it in, your lungs expanding more than they did, and the smile on your face, the endorphins, just from those things alone shifts your whole brain chemistry. And that has to have an impact on the rest of your physical health.
Thank you. I want to thank each and every one of our panelists for an incredible discussion. They not only filled our minds and our souls with some important information, but they've made me hungry because of some of the recipes and whatnot that they've talked about, but is hungry in a good way because they're talking about healthy eating and a healthier lifestyle. And so I want to thank each and every one of you for the time, the generous time that you've given to us in this webinar. And next slide, Stephanie, I want to, talk also about how, I want to thank our partners, including right here at Norfolk State University, Dr. Richmond, Stevelin Adams, for a lot of the graphic work, and for the Princess Anne County Training School and Union Kimpsville High School alumni and friends, Ms. Cofield, Ms. Hawkins Hendricks, the African American History Month Committee, and the Virginia Beach Cultural Affairs Department, Emily Labos, Hillary Plate, Alex Dye, and the whole staff at the Virginia Beach History Museums. They've really been important in this endeavor. Next slide. And I want to remind you that we have 2 more sessions coming up. The September 22nd, we've got Black Health and Wellness, looking back to find a path forward. And in December, unwrapping myth and and suspicion. I guess superstition could go in there too, but suspicion, because we know that there are a lot of questions that people have about whether or not they can trust the healthcare providers. And so we're going to delve a little bit more into that. And for the rest of this, I am turning it over to Hillary to close us out. And I just want to thank everyone, all of our guests, for viewing this particular webinar, and we will have it posted. And Hillary, if you and Stephanie could tell people where they can find the posting, that would be wonderful.
Wonderful. Thank you so much, Dr. Newby Alexander, for your expert moderation. And thank you to both you and Dr. Richmond for all of the amazing slides you've put together. And I want to thank Stevelin and Alex for all of the wonderful work they've done with the graphics and the marketing of this. Panelists, you're amazing. I sat here taking notes the whole time, and I want your recipes. And I can't wait to get back out to Purpose Park. I had the best time collecting herbs there last fall at the end of the season, and I have not yet been out for the spring bounty yet. They have to stop giving me programs so I can have a weekend free. But this was really, really enriching, and I'm excited about the next 2. As you can see, the websites for all of our information are up online. The registrations for any of these and the future talks are always at the nsu.edu website, as well as the museumsvb.org website. And you can find the videos a couple days after we close out on YouTube. NSU has a channel that I'll let Stephanie tell you about. And we are also putting them up on the museumsvb.org YouTube channels as well. So on behalf of the City of Virginia Beach, thank you all for your continued work on this series. It's so important that these kinds of talks happen all year long, not just 1 month a year or not just one weekend. So thank you for making these quarterly discussions a priority in your day so we can all lunch and learn together. Dr. Richmond, if you want to share about the YouTube links, I will sign out on behalf of Virginia Beach.
All right. Well, thank you so much. So yes, I will have the video posted on YouTube by the end of the day tomorrow, and I will email the link out to all attendees. Our last session, we had a little issue getting the attendee list, but I have it for this one. You can also find it by searching for 1619, The Making of America. That's the Roberts Center's YouTube channel from our conference series related to the commemoration of the 1619 anniversary. And it should be, I will also get it linked on the College of Liberal Arts site and the Roberts Center site at NSU as well. So we thank you very much. You should be getting information from us. I'll also include the links and the address for the Purpose Park and other things that were dropped in the chat in that email as well. So have a great rest of your week.
Yes, and happy Juneteenth. I see Michael's message there. It is. We got lots and lots going on this weekend. This was the first of the events for Juneteenth. So please do join us for future events. There's Juneteenth with the Virginia African American Cultural Center in the Vibe and down at the oceanfront this weekend. And then with Princess Anne County Training School Union Kempsville High School, we're going to be throwing the African American Music Month Celebrates Juneteenth concert party out at the Renaissance High School parking lot on Sunday from 3 to 5. So lots and lots of wonderful activities. We'll be featuring the Hampton Roads Youth Poet Laureate Ayanna Askew at that event on Sunday. And Deidre, I know you've got some other Juneteenth things happening. If you want to give a quick shout out about those as we sign off, maybe we'll find some of our attendees here. And the public art walk is at 4 p.m. today over at Portraits from a Place of Grace. The address is in the chat. Thanks, Alex, for dropping that in the chat. Deidre?
Yeah, thank you, Hillary. Our only other one is Virginia Beach Oceanfront at the Juneteenth on the 24th Street stage. I'm doing the yoga at 10 a.m. Soul Yoga, and the poets have an hour set from 1 until 2 on that
Saturday.
We're on.
Oh, no,
Sunday.
it's on Sunday. Sunday. Yep.
Yes.
So lots and lots of things going on. Some of those things beneficial to your health and today's action steps. So go join Deidre for yoga this weekend. Happy Juneteenth, everybody. Thank you, Michael, for putting that in there to remind us about. And thank you all for joining us and spending your lunch hour learning about African American health and how to improve it for yourself and your community. Thanks all.
Thank you.